Hello, parents, grandparents, and other caregivers. My name is Carl, and I'm with the First Breath program. First Breath is Wisconsin's program to help pregnant, postpartum, and caregiving individuals become tobacco-free. We provide individualized, judgment-free information and support, and have helped tens of thousands of Wisconsinites become tobacco-free. One point I want to mention right off the bat is that First Breath respects the cultural importance of traditional tobacco used by the tribal nations of Wisconsin. The information we share in this video refers to commercial tobacco use. Today I'll be sharing information about tobacco so you can make informed choices to keep your family healthy. There are many types of tobacco products, which we'll go over in a minute. What they all have in common is that they contain nicotine. Nicotine is the habit-forming chemical within tobacco, and repeated use of nicotine leads to addiction. Nicotine activates areas in your brain called receptors, which cause you to experience a rush of dopamine. The more you use tobacco, the more of these nicotine receptors your brain develops. In fact, people who are addicted to nicotine have billions more receptors than people who don't use tobacco at all. The good news is, when you quit, eventually the number of receptors can go back to normal. Next, we will talk about the different types of tobacco products that are in use today. Cigarettes are still the most common form of tobacco in use today. Cigarettes contain nicotine and around 7,000 other chemicals. As you probably already know, smoking causes cancer, heart disease, stroke, lung disease, diabetes, and harms nearly every organ of the body. Electronic cigarettes and vape products contain nicotine, flavorings, and other chemicals. The amount of nicotine varies by product, but many products contain an alarming amount of nicotine. For example, one Juul pod has the same amount of nicotine as about one pack of cigarettes. There is little information about the long-term effects of vaping, but e-cigarettes are not FDA approved and have not been proven as an effective way to quit smoking. Products like Black & Milds and Swisher Sweets tend to have higher amounts of nicotine and many of the same chemicals as regular cigarettes. Products like chew, snuff, and snus all contain nicotine and other chemicals. With smokeless products, nicotine is absorbed through the soft tissues of your mouth versus being inhaled. There is widespread consensus that use of tobacco products results in many of the health risks I just mentioned. However, it is important to note that these risks also apply to those who are around the tobacco user as well. Secondhand smoke is the smoke that comes off the end of a lit cigarette or that someone who smokes blows out after taking a puff. Secondhand smoke is produced by cigarettes, cigars, and cigarillos. The same can be said for vaping products. Secondhand vapor is the cloud of nicotine, flavoring, and other unknown chemicals that is exhaled by the user. When a pregnant person breathes in the carbon monoxide, nicotine, and other chemicals, they are passed through the umbilical cord and placenta to the baby. These exposures lower the amount of oxygen the baby can get, as well as increases the baby's heart rate. This can lead to low birth weight, preterm birth, cleft lip and cleft palate, as well as problems with the placenta and higher rates of miscarriage and stillbirth. Infants and children are also at higher risk of health issues when exposed to secondhand smoke, as their lungs and bodies are smaller and they breathe faster than adults, so they are exposed to higher levels of these chemicals. In one study, it was calculated that a child who spends an hour in a smoky room breathes tobacco smoke equal to 10 cigarettes. Infants who are exposed to tobacco during pregnancy or exposed to second and third-hand smoke are at a higher risk of asthma, RSV, pneumonia, other breathing and lung problems, as well as ear infections. They also have additional sleep problems and are at a higher risk for sudden infant death syndrome, or SIDS. Children who grow up in households with tobacco users are more likely to develop attention and learning disorders, as well as being more likely to become tobacco users themselves. Third-hand smoke refers to the chemicals from tobacco smoke that stick to clothing, hair, carpet, bedding, and furniture. You can't see third-hand smoke, but sometimes you can smell it. The truth is, we don't know what the health impacts of third-hand smoke are, and it would be difficult to separate these effects from those of second-hand smoke. But it seems likely that infants and children would be more likely to be affected by them, as they spend more time with their faces near carpeting, buried into furniture, and are more likely to put toys and other items from the floor in their mouth. If you are ready to quit, we are ready to help. Wisconsin's First Breath program has helped over 20,000 pregnant, postpartum, and caregiving individuals on their journey to becoming tobacco-free. Text FBINFO to 97779 or call 608-888-2768 to get started. Free help is also available through the Wisconsin Tobacco Quit line at 1-800-QUIT-NOW. Also, talk to your doctor. There are 7 FDA-approved medications to help you quit, and you should always talk to your healthcare provider before stopping or starting any medication. We wish you and your family all the best. Thank you for watching this video, and we hope you reach out with any questions or concerns.